So we'll be doing the wall squat. Before I demonstrate the exercise, the purpose of this wall squat is to strengthen your thighs and your buttock muscles. And what we're going to be doing is for about 2 minutes, but I'm going to be demonstrating just 5 repetitions of this exercise. Make sure you're about a foot away from the wall. You're going to lean back against the wall and relax your shoulders and neck. And what you're going to do is going to make sure your feet's about hip width apart. You're just going to slide down to about 90 degrees between your thigh and the floor, and you're going to squeeze your buttock muscles on the front of your thigh and slide back up. Now as you're doing this, just make sure that your knees do not collapse inwards or outwards. They're always in line with your second toe. And you should feel the squeeze of your front of your thigh and your bottom muscles.
So now we're going to be moving on to a step up. Similar to the wall squat, this is going to really help to work your thighs and your bottom muscles. Now I'm going to talk you through the technique, and again we're going to be doing this for 2 minutes, but what I want to make sure that you're doing is alternating from one leg to the other. So every 10 repetitions, go across to the other leg and switch legs. Now I'm going to demonstrate the first 5 on each leg, and then you can carry on. So starting off, stepping up towards a normal height step. Going to get you to put your foot up onto the step, push through your thigh, and then come back down again. Stepping up and back down again. Try your best not to slam this foot down as quickly as possible, so you're really controlling the movement through that leg that's lifting up. And then moving on to the other leg. Now if you need to hold onto a handrail for support, you can, but try your best to make sure that you're pushing off as much as you can through that leading leg.
So next up, we're going to be doing a sit to stand. We're going to begin performing this exercise for 2 minutes, and I'll demonstrate a few of these for you so you can get an idea of what the movement is that you need to perform. So we're going to start by sitting on a chair. We're going to shuffle our bottom towards the edge of the chair with our feet about hip distance apart. Crossing the arms across the chest or bringing them straight out in front of you, you're going to squeeze up through your bottom muscles, leaning forwards, coming up into a standing position. We're then going to slowly lower your bottom back down to sit in the chair. Okay. We're going to repeat these nice and slowly for the full 2 minutes. While you're doing this movement, you want to think about keeping your knees pushed out wide over your toes and not allowing the knees to collapse in as we come up and down. Our next exercise is 2 minutes of seated knee extensions. We're going to alternate each leg, and I'll perform 1 repetition on each leg with a 10-second hold. Okay. So we're going to start in seated. We're going to lift the toes off the floor and extend that leg out straight in front of you, squeezing into our thigh muscles. We're going to hold this for a count of 10 before slowly releasing down to the floor. Again, we're going to alternate sides, so lifting the toes on the opposite leg, slowly extend that leg out in front, squeezing through that thigh muscle, holding for that full 10 seconds, and then slowly releasing back down.
We'll be doing the straight leg raise exercise with foot alphabet. So basically we're trying to strengthen the front of our thigh. What you're going to do, you're going to bend one leg, and the other leg you're going to raise off ever so slightly off the bed. You can point your toes ever so slightly towards you. And what you're going to do, you're going to just sort of trace alphabet letters, preferably capital letters, all the way to Z. For the purpose of this demonstration, I'm just going to demonstrate a couple, but I would like you to try to finish A to Z and complete up to 2 minutes. If you are too quick, you can repeat again and finish up to 2 minutes.
So next up, we're going to be performing hip abductions and hip extensions. For this, you'll need a wall, and if you have one, a resistance band. First up, we're going to stand with your hand at the wall, and we're going to slowly take your leg out to the side, keeping your toes pointing straight ahead. Slowly lower back in and repeat. We're going to start with just doing 10 on each side, alternating sides for the full 2 minutes. If you want to make this harder, we can add a resistance band. If you have one that's in a loop, then great, pop that around both ankles. If not, tie yours into a loop using a knot. To perform the hip extension exercise, we're going to turn and face the wall, and we're going to extend the leg out behind you. Again, we want to be leading this movement with the heel and avoiding tilting forward from the trunk.
Next exercise, we'll be doing a hip bridge, or the London bridge if you like. So, we're going to lie on your back. Okay, make sure your back's nice and flat. Don't overarch or over tilt your pelvis. Keep it nice and relaxed. Keep your shoulders relaxed and your hands just gently placed on the mat. If you find this particular exercise difficult on the floor, feel free to do it on the couch or the bed. Now you're going to position your feet about hip width apart and just maybe 1 to 2 foot away from your bum. What you're going to do, you're going to lift your bum off the bed up to the air and sort of create a straight line between your shoulder, hip and knee, and gently lower it back down. A couple of things to note: make sure you're not overarching your back and back down. You can squeeze your bum muscles as you come up, so we're targeting the right muscles, engaging your abdominals as well. And lastly, remember to sort of peel every segment if you can, and tilting your pelvis as you come up and squeezing your back of your thighs and your bum, and slowly lower it back down. If you want a bit of a challenge, you can always hold it at that position for about 5 to 10 seconds and slowly lower it back down.
So next up, we're going to do some heel raises. So similar to the exercises before, we're going to be doing these for 2 minutes. I'm going to demonstrate the first 10 so you can see what you're doing. It's important to have something steady to hold on to, whether that be a solid chair. I'm going to use this pillar, but it could be a wall, a chair, or a coffee table. So what I want you to do, stand facing on, having something nearby to hold on to if you need to. We're going to push through our calf muscles, lift up onto our tiptoes, and then slowly lower down. Then going up and back down again. It's important to try and go as slowly as you possibly can. What we don't want is for you to be rocking too quickly up and backwards. So you're working your muscles all the way on the way up and on the way back down. Similarly to the heel raises, for this next exercise, it's something that's important to have something to hold on to nearby just in case you need to. But now we're going to start working on balance a little bit. So we're going to be doing some single leg standing exercises. So what I want you to do for the whole minute on each leg, which will make up your 2 minutes, to try your best to stay standing on one leg. So we're going to stand up on the one leg, try and hold this position. It's important to make sure that we're not excessively locking our knee backwards or standing with too much of a squat when we're trying to do this. Just a gentle soft bend in the knee and in the hip. If you need to occasionally tap for a little bit of support, that's absolutely fine. If you're finding that you're really going off balance and getting quite wobbly, just pop your foot down, stop, have a little bit of a rest, reset, and then go back to standing on the one leg. It's important that you feel safe and steady doing this. If you find that's quite easy, you can always make it a little bit harder by giving yourself a little mental task to do. So start trying to make a list in your head or count backwards from a specific number.